On March 8th, an Indian national traveled from Mumbai, India, to Kigali, the capital of Rwanda. 5 days later, he called the country's COVID-19 hotline after he began experiencing flu-like symptoms while at home. He was subsequently referred to a hospital in Kigali. On March 14th, the Rwandan Ministry of Health confirmed what many feared, the country's first COVID-19 case. The Rwandan government was already on standby to kickstart its COVID-19 strategy after closely observing how the disease was spreading in Asia and Europe. Its president, Paul Kagame, exhorted Rwandans to unite and show discipline in confronting the challenge.
Abanyarwanda dushyize hamwe twivanye mu bibazo byinshi mu bihe bitandukanye. Ubufatanye bwacu ndetse no kudatezuka birakenewe muri iyi ntambara turimo yo kurwanya iki cyorezo.
It would use innovative and aggressive methods to fight COVID-19, including enlisting the help of robots and drawing on its experience from handling past outbreaks, including Ebola. In July, the European Union lifted travel restrictions for Rwandan residents, a testament to the country's overall response to contain the pandemic. Rwanda became the first country in Africa to impose a nationwide shutdown on March 22nd after a wave of imported cases in the country, and the government's early response made all the difference. The lockdown allowed the government time to complete setting up testing centers, isolate other imported cases, and treat infected patients. Rwandans were also reminded to practice good hygiene, while hand-washing stations were created around the country.
The first days were a bit challenging because, you're not used to stay home all day long.
Jean-Luc Habimana, a documentary photographer and Kigali resident, remembers the panic he felt when the country confirmed the first few cases of COVID-19.
It felt more real. It felt, because before it'd be like, oh, people were like, it's happening in China, maybe it's, but then when it was in Rwanda, they were like, oh, the first case was recorded. Like, oh, this thing is real, this thing is serious. They had started following the measures against COVID way before the first case was recorded. So we're like, oh, pretty sure things are gonna get controlled and stuff. But then of course cases kept coming.
By April, the country had 75 cases. Recognizing the urgency of stepping up its contact tracing system, the Rwandan government gathered around 2,000 frontline workers and contact tracers, including medical students and police officers, to meet the challenge.
The decision to use other people who could do the same job as doctors and nurses could be doing was not only to maintain the continuity of services in hospitals, but also was to upgrade and to give skills to people who'd going to use these same skills in the future.
Sabin Nsanzimana is directing the Rwandan government's COVID-19 strategy and implementation. He explains the rationale behind the country's unorthodox and aggressive contact tracing plan.
We came from 26 years ago from a genocide against the Tutsi in Rwanda that took out of the health system 80% of the health personnel capacity were either killed, either participated in the killing, or just doctors, nurses, and health personnel just become themselves patients in need of care. You could imagine that with a COVID pandemic coming in, as we build the system, would cause more harm and destruction of the system that was already at a stage of reconstruction. The best economy you can imagine is when people are healthy. When you do proper lockdown, you are indirectly investing in the economy.
I can measure your temperature.
Okay, go ahead.
Over the years, the government has made strides to improve its healthcare system. Despite being a developing country, Rwanda has universal health coverage, while plans are underway to implement more digital solutions in its healthcare system. In fact, the country employed the use of robots during the pandemic, which can deliver food, medication, and conduct temperature checks on up to 150 people per minute. Sabin, one thing we've been talking about is the use of robots in Rwanda, which we haven't seen a lot in other countries. So Why did Rwanda decide to take this approach?
If you lose your internist or your pneumologist because he's COVID positive and is out of work, and you only have 2 or 3 in the country, that will be catastrophic. So the idea was more to protect those health personnel so that they can freely manage cases without interacting with patients so often.
Just as the government slowly eased lockdown restrictions in May, there was another surge of imported cases, mainly among truck drivers from neighboring countries. One such cluster of COVID-19 cases was in the district of Rusizi, in the western province of the country. Rwanda's frontline workers were recording 10 positive cases out of every 100 samples in Rusizi, which borders the Democratic Republic of Congo and Burundi. In 2014, the same district was at risk of an outbreak of a different, deadlier virus.
The recently confirmed case of an Ebola virus outbreak in Port Harcourt, River State capital, which claimed a life on Friday.
The first case of the West African Ebola epidemic was reported in Guinea at the end of 2013, and it eventually spread to pockets of the continent, such as Port Harcourt in Nigeria, as well as the United States and Europe. While the outbreaks were not linked, the Democratic Republic of Congo was also recording rises in the number of Ebola cases. By the end of 2019, Congo recorded more than 3,000 cases, of which 2,203 people died. That's a death rate of 66%. Rwanda was particularly at risk since tens of thousands of people ply the border crossings daily. A team of Rwandan experts was sent to Congo to learn from their battle against Ebola, while a vigorous screening process and enforced hand-washing at the border ensured that not a single case of Ebola was recorded in the country. This experience, Sabin says, gave Rwanda the expertise and infrastructure to fight COVID-19.
Our teams were exposed to the response, and also they helped. But also they learned a lot from this exchange. The same people, when they return back to Rwanda, are the ones still today at the forefront to respond to COVID-19.
As the government began recording more clusters of COVID-19 cases in districts like Rusizi, it stepped up its approach in May to counter this rise. One such approach is called pool testing. This method involves combing samples from a group of 30 people, for example, instead of doing 30 individual tests. This technique yields a single result. If a test detects the presence of the virus, the 30 individuals are then tested separately to determine who is positive. At the start of the pandemic, the country was testing close to 1,000 samples a day, but a pivot to the pool testing approach increased its testing capability 15-fold. This strategy has also been successfully adopted in other African countries, like Ghana, and was launched in the United States in July.
I think the government is really doing their best to test people who have symptoms as fast as possible. There were random testing programs already, mostly in the capital.
5 months into the pandemic, and Rwanda has outperformed many countries with its handling of the outbreak. Despite a spike in infections in the middle of August, the country's death rate is below 1%, significantly lower than the fatality rates worldwide. While Rwanda has been hailed as a role model for other African countries, some have criticized its aggressive approach, such as the police's alleged excessive use of force during the lockdown. The government has since launched an investigation into these claims.
When you fight a pandemic, sometimes you need to take actions that will protect people. Some people would say, no, it doesn't exist. Others will try to undermine the actions that are protecting the people. We've seen it in many countries, and we've seen it how it actually destroyed the response.
So Rwanda's fight with COVID-19 is still ongoing, but thanks to its early and aggressive strategies, both its economy and borders have now reopened. However, Rwandans remain cautious and still wear masks in public places. Jean-Luc says he's proud of Rwandans and how responsive they've been to the government's measures. He remains optimistic, not only about his country's future, but his continent's too.
It makes me excited about the future because I really I really see the potential. And when I look at my generation, how young people are working so hard to move my country, move Africa to a better place. As a storyteller, I feel even more excited to leave the story and get to tell them.
As usual, guys, thank you so much for watching our video. What do you think about how the Rwandan government handled this? Comment below and don't forget to subscribe.